We sat down with Bonnie Hebert just one day after her second Bonati spine procedure. She shared with us what caused her issues and how it changed her life.
I came to be in pain from a car accident in 2010, and it's progressively gotten worse since. My pain started in my lower back and eventually went down my left leg and started hurting both my hips as well. The past year I've been having trouble walking and haven't had much feeling in my left leg at all. Been hard to take care of my 4-year-old daughter and haven't really been able to do much of anything except for lay in bed. I cannot cook dinner for my family. I wasn't able to sleep more than maybe 2 hours a night. A good night, maybe 3 or 4 hours. Hard to pretty much clean anything, play with my daughter, do laundry, driving. Everything was pretty much a very hard task for me to do without help.
She lived this way for many years, attempting countless conservative treatments without true pain resolution. Then, in fall of 2017, through word of mouth, she discovered the Bonati Spine Institute.
Before coming to Bonati Institute, I did about 6 years of chiropractic care. I've had many injections in my lower back, like nerve block injections and steroid injections. Massages pretty much every month, sometimes more, using all kinds of creams and lotions and pain pills and just anything I could get trying to help my pain. I sought out Bonati's treatment because I had 2 people through friends that we knew that had had very successful surgeries with Bonati. And then I started seeing the commercials on TV and I started asking lots of questions for the people who were friends of my friends. How they were doing now and how their surgery went. And after that, and coming to the Bonati Spine Institute and learning about the procedures, that's when I decided to pick Bonati.
We had the chance to visit with Dr. Bonati to learn more about Bonnie's case and the specific condition that was causing her pain.
This is a case that is very dramatic because of the amount of pain that the patient has. But the patient is a young person who had a massive herniation on the 5S1 level. This herniation is transferred to see how big is the hernia here. If you look at this hernia at this level, canal for the spinal cord is very wide. It's a young type of a spine. But when you see at the level of the damage, you can see how this one looks totally flat. See how nice and round is the canal here. This canal looks like the spinal cord here is being pushed by this element on this side. This is a rupture of the disc. And if you look at this, it's a massive rupture. See the deformity is flattening the nerve that is on the left side. That is a nerve that goes from the back to the butt, to the back of the thigh, back of the calf, and outside of the ankle. So this patient has a tremendous large compression of the S1 nerve root.
They did do my MRIs and my x-rays, and when Dr. Bonati came in, he told me to be quiet and not tell him what was wrong, and he guessed exactly what my problems were, what my symptoms were, where the pain was coming from. It's like he knew me like a book, pretty much. He knew everything that was going on with me without me having to verbalize anything to him.
At the Bonati Spine Institute, procedures are performed in a twilight state, where the patients are lightly sedated but remain aware and alert to communicate with the surgical staff during the procedure.
The one thing I was scared of for back surgery is them kind of going in blind and not knowing if they're touching your nerves or whatever. You're able to watch the procedure if you want. You're able to hear what they're talking about and what's going on. But at the same time, you're able to verbalize where it's hurting so they know exactly what to do to you. I just found that amazing, and I don't think I would have done back surgery without that.
In a healthy spine, there is space around the spinal cord and spinal nerves, but a herniated disc can constrict the spinal nerves. Dr. Bonati further illustrates the nerve compression on the level at which Bonnie was experiencing her symptoms.
And the S1 nerve root is formed here, being pushed back here, is being pressed there, and exits here. So the symptoms are associated with this because of the pressure that we have here, and the symptoms are also associated on the 5 nerve root because this lump here is practically touching the nerve on that area. So we have 2 areas on this patient's symptoms. Once you remove this pressure here, operating between 5 and S1, you're going to remove the pressure on this nerve, and you're going to remove the pressure on that nerve. And that's going to correct the patient's problem.
I had to have 2 areas done. So the first area, I could definitely feel that area pain-free and pretty much coming back to life. Like my 4 baby toes on my left foot, they started to feel like they were tingling again. And then with the second surgery, the same thing. Right after surgery, a few hours after this time, I could feel a huge difference. And last night, the first night I slept after my second surgery, my legs did not hurt all night long.
If a patient has been suffering with a condition for an extended period of time, it makes sense that it may take some time to recover. With the targeted Bonati spine procedures, patients like Bonnie can see and feel results shortly after leaving the operating room.
I went from not being able to walk more than a few steps or 2 minutes, and now I'm walking at least 40 minutes a day without pain. I'm looking forward to getting back to playing with my daughter and my husband as a family, and also hopefully rollerblading once again someday. Based on the results I have, I will, and I have already recommended Bonati to a few friends of mine, and I definitely will be talking about them forever because they have changed my life, and I can't wait to see some more results as I work on my recovery.